So Betzy is our Daisy Award winner this month. Big surprise. So do you remember this person? A family member who wrote this about you. I cannot say enough about Betzy. She is a phenomenal person. She is very caring, extremely on top of every situation, and completely attentive. She took care of my husband in the ICU, and I was totally at ease and trusted her. She saw things that others did not, and then they were taken care of. She was far better than Dr. Benjamin Colt. Does this woman know you?
Are they really writing that?
Betzy also was attentive, caring, and honest with me, making sure I was taken care of. She is a blessing to everyone.
Thank you.
Congratulations. You so deserve it. Hi, Betzy. So you are this month's Daisy Award winner.
Yes.
It's a rainy Monday morning. Were you surprised to see us coming this morning?
Yes.
Why?
It's day 5.
You were surprised
Day
to see
5.
anybody coming this morning?
Yes.
Well, on day 5, you deserve it more than ever. So tell us a little bit about you. You work at the Torresdale ICU. How long have you worked here?
I've been here since 2005. I started off as a monitor tech.
Came right to ICU?
Went to step down.
Okay.
Carolyn's always been my manager. Even in step down, she was covering step down.
She's following you.
Yeah. And then 2 years later, I came to the ICU.
And you've been here since?
And I've been here since.
What do you like about working here?
The people, my coworkers, the patients. It's a mixed ICU.
Yeah.
So we get to do everything instead of it being just concentrated on just one specific thing.
What is it about that you like?
You're constantly learning. You have to learn. You have to know what you're doing. You can't just come in and expect to know what is happening. Like, you have to be on top of it. It's a trauma center, so we get our traumas, we get our strokes, and sometimes they're both. We get our medical, sometimes we go to surgery, so they're all 3. It's a mixture. So you have to know everything. They don't just specifically put you in one unit and that's what you concentrate on. So that's why I like it. And I drive an hour to get here, so.
Keep driving. If you need a ride, I'll come get you. So clearly, I mean, what you're articulating about what it is that you like about it is exactly what the family member cited that you're exceptional at, right? I mean, she talked about how attentive you were, how you were on top of things, how you picked up on things that other people just didn't. So you're clearly really good at what you do as well. What do you think it was with this family and with this patient in particular that stood out for them?
It was a lot going on. Actually, he was the specific type of person I'm talking about. He was a trauma patient that was also a neuro patient and also a neurosurgery patient. Had a lot going on, so you have to think of all the functions of all the systems, and everyone collaborates. So that's what makes it working here easier, because everyone has to speak to everyone. No one just does anything without speaking to someone else. So that helps.
And you're the gatekeeper of that.
And we're the gatekeepers. Yep, we're their eyes, and they get to see what's going on because we tell them as nurses. That's what we're supposed to do.
Yeah. Was there anything in particular with that wife that you remember or that stood out for you?
She was distraught. She wouldn't leave. It was the wife and the mother that were constantly here. And they just wouldn't go. Just explain everything. You have to explain things as you're doing them because it's boring to them.
Yeah.
So, but it's something I commonly do. I always do that. That's just how I provide care. I think everyone should be spoken to, explained, just so they're not scared. Because this is like the worst place you could be.
That's scary.
No one wants to be here. Not because it's not planned. Yeah. It's not planned to come to the intensive care unit.
And the intensive care unit is, a step up on the scary meter, right?
That's
for a patient and a family.
That's the top.
It really is.
You can't go anywhere else.
And you clearly put her at ease. I mean, she said that. I mean, for the way you're describing her, which is, like you said, is understandable. You clearly, and the way you were interacting with she and her family, was really impactful to her, to the point where she actually wrote a letter, which, as you know, that's not, most people think it, and they may sit at home and think, wow, I love Betzy, but to actually sit and, you know, write all that down and be thoughtful and think about sending that to us is pretty,
Yeah.
you had to impress upon her.
It was a great family.
You put them at ease at a time when that's not an easy thing to do. So thank you for that. On behalf of them, they articulated it very well. I know you've been here for a long time, but you're also really active, I know, in the National Association of Hispanic Nurses, and you're our Philadelphia president.
Yes.
Is that correct?
Yes.
So talk a little bit about that. I mean, that's in and of itself impressive,
Yeah. Thank you.
let alone the work you do.
So the National Association of Hispanic Nurses in Philadelphia chapter, what we try to do is mentor our students. We go out to our community. We provide services to our community. We do a lot of screenings. We partner with a lot of different organizations. We provide free flu vaccines, which we just completed 2 weeks ago. We go to mission trips. I just came back last week from a mission trip.
Where were you?
Puerto Rico. Visited 5 different towns, visited over 500 patients, did 5 different health fairs.
Wow.
It was like working 8 till 7 every day, getting ready for each town every day, staying at, we had a lot of help. We stayed in a women's shelter in one town. We were just hopping around, and it was great. It was a great experience, and because of the National Association of Hispanic Nurses, we're able to come together.
Mm-hmm.
And our biggest thing is providing back to our community. So you'll see most of us in wherever the Hispanic community is, but we also like to partner with the Black community also, the Black and Brown community.
Nice. That's exciting, and I
So-
can only imagine, you know, a profound experience to be able to travel to Puerto Rico to do that. What you're doing here, you
Yeah.
know, and to be able to see that, you know, some things are just universal, and you know, need certainly is one of those.
Yeah.
But in addition to being obviously an exceptional clinical nurse and taking great care of patients, you're an incredible mentor to younger nurses and to older nurses and to all nurses, and you know, just doing so much good work. If you could give us some advice, just in general, in terms of how to be better, in terms of being patient-centric, what would you tell people? Anybody?
Anyone?
Yeah, anybody who works in healthcare.
Just see yourself as that patient. Pretend that's you. And how do you want things delivered to you? So I always picture myself as that person, and how I want to be treated, and how I want things explained to me. So that's what I do.
Is that hard when you're caught up?
I don't think it's hard. I think it makes working easier, because if you picture yourself and not just you're helping a stranger, your care is different, because it's you. That's you. What do you want for yourself? So
How do you keep that top of mind? So you said that today's day 5, which is in and of itself difficult.
today's day 5.
So you're tired, I'm imagining.
I'm exhausted.
It's a rainy
I'm extremely
day.
exhausted.
So how will you do that on a day like today? Like how do you maintain that all these years later? I mean, it's not like you're, you know, a young idealistic nurse, right?
No.
You're seasoned, you've been here a long time, you've seen a lot, you know, you've been through a lot.
It's because of that. Tomorrow's not guaranteed. Today could be my last day. So I leave this earth and not in a good mood, and not providing good care, not doing what's right. Tomorrow's not guaranteed.
Well, you're fabulous. I hope you know that. I hope somewhere inside of you,
Thank
you
you.
are very
Thank you.
aware of just how exceptional you are on just so many levels.
Thank you.
You know, so on behalf of all of us here and all of us in the nursing community, thank you for what you do, and thank you for who you are.
Thank you.
So we appreciate you.